Hello everyone, welcome to your exam 2 review. So you need to know and understand fetal growth abnormalities in the newborn. What's the causes of fetal growth restriction? Review small for gestational age, large for gestational age, and appropriate for gestational age. And know the weight in grams. Review problems that an infant with SGA may have. Gestational age assessments. Make sure you're reviewing neuromuscular and physical maturity. And remember, we're doing these assessments on infants that are not showing appropriate measurements according to gestational age. Know the terms preterm, term, late preterm, postterm, and know the weeks of gestation that constitutes for each of those. The normal newborn. You need to know normal newborn vital signs: temperature, pulse ox, respirations. Know the normal ranges. Periods of apnea. Is this normal or abnormal? And if it's abnormal, what's the cutoff? What does normal newborn assessment look like? What would you expect to see as far as position, skin, tone, head assessment, fontanelles? Which organ systems are immature in the newborn? What are some variations of normal? So think about birthmarks, Mongolian spots. These can be normal in some babies. Gestational age in weeks. Okay, so we discussed that in the last slide. When is the normal time frames for voiding and stooling? When should we expect babies to pass meconium? Know the purpose of the vitamin K injection and procedure for administering vitamin K. So that would include things like syringe size, needle size, etc. What's the site that we use to give that injection? Breastfeeding. So know education for patients, how often, positioning, latching, avoiding sore nipples, voids and stools expected, as I mentioned on the previous slide. No mastitis, plugged ducts, and engorgement. This should be a review for you, but this is what we look for in some breastfeeding issues. So what would be the difference in all of those conditions? Review important feeding cues, and then review breast milk storage, appropriate storage, length of time of storage, etc. APGAR scoring components. Be able to calculate an APGAR score. What are the 5 components of the APGAR? Newborns at risk. Signs of respiratory distress in the newborn. Implications of jaundice in the newborn, and make sure you understand the process of bilirubin conjugation. Risk for hypoglycemia in the newborn. What sets these babies up for hypoglycemia? What's a normal cutoff for glucose in a newborn? Risk of hypothermia. Make sure you know the mechanisms of heat loss. Menstrual disorder, so amenorrhea. What are the causes? There's a primary and secondary cause. Dysmenorrhea. Okay, know the non-pharmacologic and pharmacologic treatments. Endometriosis, causes and treatments. Infertility. Think about the causes and think about infections and different disorders that can lead to infertility. This does not include male infertility. So breast disorders, we reviewed a little bit earlier. Mastitis, make sure you know that. Breast engorgement, cancer of the breast, and associated risk factors. And that is it. If you guys have any questions, please email me in Canvas.